My name is Richard Welbourn. I'm a consultant upper GI and a laparoscopic surgeon. I'm going to talk about bariatric surgery today. Bariatric surgery comes from the Greek words meaning baros or pressure and iatric, which means treatment of. And what this means is essentially weight loss surgery. So patients who have a very high body mass index and want to lose weight and have maybe tried the GLP-1 medications and found that they don't work, or they want a permanent fix for their weight, may choose to have bariatric surgery. Now, the main operation we do is called a gastric bypass. This works in the same way as the GLP-1 medications. So after surgery, patients typically will lose their appetite and will feel full very quickly. So they don't feel hungry, and sometimes patients will say, did they operate on my tummy, or did they turn a switch off in my brain to stop me feeling hungry? And the effect is profound, and it means that patients will lose perhaps 20 or 30% of their weight over the next 12 months. So the surgery improves your quality of life, that is your feeling of general well-being, as well as improving all the medical problems you may have with your weight, such as type 2 diabetes, problems with mobility such as arthritis, sleep apnea, blood pressure, and polycystic ovaries. So patients who have had problems conceiving may find that their fertility improves after surgery, and all the problems that they have with their weight in general will increase as the weight comes down. So this surgery is life-changing. Many patients these days have GLP-1 medications, but these only work as long as you take them. As soon as you stop taking them, your weight and appetite will return. An advantage of surgery is that the weight loss is long-term because the operation turns off your appetite and satiety, so you don't feel hungry, and that persists for many years. So we know that the weight loss after a gastric bypass of 20 to 30% will persist for at least 10 or 20 years after the surgery. The surgery itself is all done keyhole, that is minimally invasively, with 4 or 5 small incisions. So patients come into hospital, they have the operation, and usually within 24 to 48 hours, they'll be okay to be discharged. Full recovery is by about 3 weeks after that, and patients do need to take vitamins and mineral supplements for the rest of their lives, and it's very important that these are taken. We will support patients with a full dietetic support, that is a qualified dietitian who has an interest in weight loss, and also a psychologist to help patients negotiate their way through the huge changes that can happen after surgery as people's shape changes and as they lose weight. So in the Nuffield Hospital, we have a full team of people to support you, and we do the same service as we do in our NHS service, which is in Musgrove Park Hospital in Taunton. We've been doing this surgery for 20 years now. We are an international centre of excellence accredited by the US Surgical Review Corporation. We've done several thousand patients. We have a unit of 5 consultants doing the surgery and a full team, or full multidisciplinary team of anaesthetists, medical doctors, dietitians, psychologists, as well as specialist nurses to support you through the process. We try and look after patients for the packages 2 years after surgery. Any problems during that time, we endeavour to look after patients and make sure they have the best support possible. The risk of dying after surgery is very low. In our hands, the risk of dying is less than 1 in 1,000. The risk of having to have a reoperation is something like 3 or 4%. You need to discuss this with the surgeons. As I say, it's very important to take vitamins and minerals lifelong to make sure that any deficiencies after surgery are not there because you're taking vitamins and minerals to support you. So this can be life-changing surgery. Come and talk to us about the available options. We're happy to help.